At Modern Heart and Vascular Institute, they want to help you avoid a heart attack. I got the most modern heart scan recently to see exactly where I stand, and thank goodness, no sign of heart disease. Dr. Rajiv Agarwal with Modern Heart and Vascular Institute shared how simple things like understanding your blood pressure can also be a lifesaver. Dr. Agarwal, so many people are afraid of cancer, and rightfully so, but a lot of us don't think about the #1 killer of men and women basically around the world when it comes to health.
Heart disease is by far the most common cause of death in our country, Deborah. So we're really trying to control the risk factors such as high blood pressure that lead to that high risk.
We hear check your blood pressure all the time. I think a lot of us don't really understand what the connection is. So when someone comes to you and they say, oh yes, I have high blood pressure, what does that tell you in terms of how the heart is functioning or not?
Good question. So first of all, blood pressure is one of the silent killers. 40% of us in America either have high blood pressure or have undiagnosed high blood pressure. So blood pressure leads to a lot of problems such as heart disease, increases your risk of having heart disease by 2 times, strokes by 4 times, congestive heart failure, kidney disease, vision problems, erectile dysfunction in men, to name just a few. It is very, very important that we get people to check their blood pressure regularly, Deborah, and seek help for it if it's elevated. Traditionally and recently, the numbers have changed. Nowadays, we say anything above 120/80 is labeled as high blood pressure. Not everyone is going to need medications or help, but by definition, 120/80 is now considered high. So people should really be encouraged to check it at home and seek help if it's more than that.
Now, a lot of us would come in when we're having symptoms. The problem with this is what?
Well, the problem is a lot of people do not have symptoms. It's called one of the silent killers for a reason. So you do have to make the effort and check your blood pressure at home. And if it's over 120/80, seek guidance from your primary care physician or from a cardiologist to help out with that. Some people do have symptoms, and those symptoms could be very minimal to significant, such as shortness of breath, chest pain, dizziness, lightheadedness. Headaches is a common symptom as well, Deborah. But again, to your point, a lot of people just do not have symptoms. So we encourage people to go out there, get a good blood pressure machine, and start checking it on their own.
All right, there's a proper way to do that too, right?
Yeah.
Like don't have 50 cups of coffee and then go, let me check my blood pressure.
No. You definitely don't want to have anything to eat or drink for at least 30 minutes prior to, and don't want to have just done exercises, especially alcohol or caffeine you don't want to have had. And then you want to be sitting on level ground with your feet uncrossed. Or some of our elderly patients, we ask them to stand up and check it because they have symptoms of dizziness, lightheadedness when they stand up all over a sudden. So we have them check it standing up. But you do want to check it sitting down or standing up on level ground without having had anything to eat or drink recently. And then you want to check it in your upper arm. You don't want to check it in your wrist. The wrist machines are okay, but the arm machines are a little bit better because they're closer to your heart. And you're actually measuring the pressure not in your arm. You're measuring the pressure in your heart. So the closer you are to the heart, the more accurate the numbers will be.
All right, and speaking of numbers, we have that top number, that bottom number. What do both of those numbers mean?
Good. So the top number is actually telling us how much pressure the heart is generating to overcome the blood vessels. So think of it like this. If you're breathing through a bigger straw, you can breathe a little bit more gently. But if you have a smaller and smaller straw, you're going to have to breathe a lot stronger to get the flow through there. Same thing with the blood pressure. We're trying to see how tight the arteries are inside the body and how hard the heart has to work to overcome that. So the top number tells us how strong, how much pressure is the heart having to generate to overcome that. The bottom number we get when the heart is relaxing and not pumping. So how well the heart is able to generate pressure without having to pump, just at rest. So both of those numbers are important. As we get older, the bottom number becomes a little bit more important because, the top number becomes a little bit more important because the bottom number will keep coming down on its own as we age, just because of the blood vessels aging as well. So the top number when we're older.
Yeah, Dr. Agarwal, I don't have to worry about it though, because I can just take a pill for that.
Not a big
And speaking of, a lot of people have that kind of mindset, but your goal is let's not rely on medication to manipulate some things. Let's rely on putting your body where it should be and removing those risk factors if we can.
Absolutely. We want to avoid medications. I hate taking pills. I hate prescribing pills. There are ways to lower the blood pressure without the use of medications. For example, exercising properly, reducing your salt intake. You can increase your potassium intake, and that helps. And you've got to maintain a healthy weight. Stress has a lot of part to play in the blood pressure. So we sit down with our patients and try to monitor what their numbers are and how can we adjust their lifestyle at home to lower their blood pressures without jumping straight to medications.
All right, I want to end with this because knowledge is power. I came to your center, I had a heart scan, and I got to tell you, the weight of the world has been lifted off of me in that area because you were able to look and see where my heart stood, and you said no sign of heart disease, so go tend to other issues, right? So it's nice to have that kind of peace of mind, and you are one of the few people who actually does the heart scan with that level of technology.
Yes, ma'am. And thank you for coming, Deborah. It was good to see you in person again. But yes, that technology is able to diagnose heart disease at a very, very early stage. And high blood pressure, diabetes, high cholesterol, smoking, all of those risk factors are important. And we're able to find the effect of those risk factors on heart disease at a very young age with modern technology like that heart scan that you had done.
Yeah, so you can actually be preventive.
Absolutely. It's all about prevention. We are not going to wait until the heart attack, until the stroke or circulation problems, and then help our patients. We are here to prevent them and catch them early and basically cure them with as little to do as possible for our patients. And it's such a good feeling that you're able to cure things nowadays with modern technology without use of pills and prescriptions and surgeries and procedures, Deborah.
All right, Dr. Agarwal, thank you very much.
Thank you, Deborah.